Picture this. You wake up on a Saturday morning, sun's coming through the window, you reach for your coffee mug, and suddenly your hand just gives out. The mug slips, coffee everywhere. Your first thought is, I probably slept on my arm wrong. Maybe I overdid it at the gym yesterday. But what if it's not that? What if that moment, that little glitch your body just threw at you, is actually a warning sign that something serious is happening inside your neck right now in the arteries that feed your brain? I'm not trying to scare you, but I am trying to get your attention. Because here's the truth that most people don't know. Up to 80% of strokes can be prevented. 80%. That's not some made-up number. That's what the research tells us over and over again. The problem is, most folks don't know what to look for until it's too late. And one of the biggest causes of stroke, especially in men over 55, is something called carotid artery blockage. These are the two major blood vessels running up each side of your neck, and their job is to deliver oxygen-rich blood straight to your brain. When they get clogged up, bad things happen. Today I'm going to walk you through 5 warning signs that your carotid arteries might be blocked. And I really need you to stick around for number 5 because that one can actually show up before any of the others, and catching it early could literally save your life. Before we get into it, let me tell you who I am and why I care about this so much. I'm Dr. Claire Weston. I've been practicing cardiology for over 20 years now, mostly out here in the Midwest. My day-to-day work focuses on heart rhythm problems and cardiac devices, pacemakers, defibrillators, that sort of thing. But over the years, I've seen firsthand way too many times what a stroke does to a person. I've watched strong, independent men lose the ability to speak, lose the ability to walk, lose everything because a blockage in their neck went undetected. That's why I started talking about this publicly. Prevention is where the real power is. Not after the damage is done, but before. Now, I do want to say this up front. Nothing I share here replaces a visit to your own doctor. If anything I described today sounds familiar, if you're sitting there thinking, wait, that happened to me last week, please don't just file it away. Go get checked. Ask your doctor for the tests. Don't let anyone brush you off. And I'll tell you exactly what tests to ask for later in this video, so you're not walking in blind. All right, let's start with some basics, so everything else makes sense. You've got 2 main carotid arteries, one on the left side of your neck, one on the right. Each one splits into 2 branches. The internal carotid artery carries blood directly up into your brain. The external carotid artery supplies blood to your face, your scalp, other areas around your head. Now here's what makes these arteries so critical. Your brain, even though it only makes up about 2% of your body weight, uses roughly 20% of all the oxygen your body takes in. 20%. That's a huge demand. So when these arteries are open and clear, blood flows freely, your brain gets what it needs, and everything works the way it should. But as we get older, or if we've got certain risk factors, fatty deposits start building up on the inside walls of these arteries. These deposits are called plaques. Same kind of buildup you hear about with heart disease. Over time, these plaques narrow the space where blood flows through. And if the narrowing gets bad enough, or if a piece of plaque breaks loose and travels up into the brain, that's when you get a transient ischemic attack, what most people call a mini stroke or full-blown stroke. Both can be devastating. Both can be fatal. So who's most at risk here? While carotid artery disease can happen to anyone, certain factors make it a lot more likely. And guys, I'm going to be straight with you. Men are hit harder by this than women, especially as we get older. First, age. If you're over 55, the likelihood goes up significantly. Plaque buildup is a slow process. It's been happening your whole life, but it tends to reach critical levels as you get into your 50s, 60s, 70s. Second, high blood pressure. If you've got hypertension, and a lot of men do without even knowing it, that constant elevated pressure damages the inner walls of your arteries. Think of it like water hammering against the inside of a pipe year after year. Eventually, the pipe wears down. Third, high cholesterol, specifically high LDL, the bad kind, and low HDL, the good kind. High LDL is basically fuel for plaque formation. Fourth, diabetes. Excess glucose in your blood damages blood vessels and speeds up atherosclerosis, which is the hardening and narrowing of arteries. Fifth, smoking. Every cigarette dumps thousands of chemicals into your bloodstream that damage the lining of your blood vessels. Smoking also lowers your good cholesterol and makes your blood thicker and stickier, which just makes everything worse. And sixth, obesity. Carrying extra weight often goes hand in hand with high cholesterol, high blood pressure, and diabetes, all of which pile on the risk. If you checked off even one of those, and most men over 55 can check off at least 2 or 3, then what I'm about to tell you is especially important. Warning sign number 1, sudden weakness or numbness on one side of your body. This is one of the most common early signs that something's going wrong with your carotid arteries. It might hit your arm, your leg, or even one side of your face. You might be carrying a bag of groceries and suddenly your grip just fails. Or you're walking across the living room and one leg buckles under you for no reason. People often write this off. They think, I'm just tired. I've been working too hard. My back's acting up again. But here's what's actually happening. When a carotid artery narrows, blood flow to certain parts of your brain gets reduced or temporarily cut off. The part of your brain that controls movement on one side of your body isn't getting enough oxygen, so it misfires. The nerves can't do their job. Here's a quick test you can do right now. Raise both arms above your head and hold them there. If one arm drifts down, or if you can't raise it at all, that's a red flag. Even if it only lasts a few minutes and then goes away, do not ignore it. I had a patient, let's call him Dave, 62 years old, retired electrician, tough as nails. He had a brief episode where his left arm went weak, couldn't hold his wrench. It passed after about 5 minutes, so he shrugged it off, figured it was a pinched nerve. 2 weeks later, Dave had a full stroke, left side of his body. He spent 3 months in rehab learning to walk again. And the thing that kills me is, if he'd come in after that first episode, we could have caught it. We could have prevented the whole thing. So please, take any one-sided weakness seriously. Warning sign number 2, trouble speaking or understanding speech. This one can be really unsettling. You're in the middle of a conversation and suddenly the words won't come out right. Your tongue feels thick, you're slurring, or you're saying words that don't make sense. Sometimes it's the other way around. Someone's talking to you and it sounds like gibberish, like they're speaking a foreign language. The people around you might notice before you do. Your wife might say, "Honey, you're not making any sense." Here's why it happens. The areas of your brain responsible for language, producing it and understanding it, are extremely sensitive to changes in blood flow. When the carotid artery feeding those areas gets partially blocked, even briefly, those language centers can malfunction. Here's a simple test. Try repeating a basic sentence. Something like, "Today's a beautiful day." If you can't get the words out clearly or if the sentence comes out jumbled, call 911 immediately. Time is everything with stroke symptoms. I'll never forget this one. My neighbor's wife rushed her husband to the ER after he started mixing up words in the middle of a dinner. He was trying to ask for the salt, and what came out was completely garbled. Turned out he was having a TIA, a mini stroke. They caught it fast, got him on the right treatment, and prevented what could have been a massive stroke. Her quick thinking saved his life. Warning sign number 3, blurred vision or temporary vision loss. Some people describe it like looking through a frosted window. Others say it's like a curtain dropping down over one eye. You might lose vision partially or completely in one eye for a few seconds or a few minutes, and then it comes back. A lot of people chalk this up to eye strain, staring at the computer too long, or needing new glasses. But here's the deal. Reduced blood flow through a narrowed carotid artery can temporarily starve the optic nerve or the parts of the brain that process vision. Even if your sight comes back completely, do not brush this off. Consider it a critical warning sign and get to a doctor. A buddy of mine, retired Army guy, tough as they come, experienced what he called a shade dropping over his left eye while he was driving. Lasted maybe 30 seconds, then cleared up. He didn't think much of it. Next day, he ended up in the ER with a minor stroke. His story is proof that even brief vision changes can be the prelude to something much worse. Warning sign number 4, dizziness or loss of balance. Now, a lot of guys experience dizziness from time to time, and usually it's nothing. Dehydration, low blood sugar, inner ear problems, getting up too fast. But there's a specific kind of dizziness that should set off alarm bells. I'm talking about sudden severe vertigo where the room is spinning or you suddenly can't walk straight, like someone pulled the rug out from under you. This happens when the cerebellum, the part of your brain that controls balance and coordination, isn't getting enough blood flow due to a carotid blockage. If the dizziness is intense, if it comes with trouble walking in a straight line, or especially if you lose consciousness even for a second, do not chalk it up to fatigue. Consider it a possible sign of carotid artery blockage and get medical attention right away. Here's a simple self-test. Try walking heel to toe in a straight line, like a field sobriety test. If you're veering off, stumbling, or feel disoriented, that's a symptom worth paying attention to. Warning sign number 5, and this is the one I really want you to remember, a whooshing sound in your neck. This last sign often gets overlooked because it doesn't come with pain. It doesn't come with any dramatic symptoms at all. Most of the time, it's discovered by accident during a routine physical exam. Your doctor puts a stethoscope to your neck and hears a sound called a bruit, basically a whooshing or rushing noise. Here's what's causing it. When blood flows through a healthy, wide-open artery, it's smooth and silent. But when plaque has narrowed the artery, blood has to squeeze through a tighter space, and that creates turbulence, a vibration that your doctor can hear. The reason this sign is so important is that it can show up before any of the other 4 symptoms. Before the weakness, before the speech problems, before the vision changes. It's your body giving you an early heads up that something's building. If you've got any of those risk factors I mentioned earlier, high blood pressure, high cholesterol, diabetes, smoking history, being over 55, make sure your doctor's listening to your neck at every checkup. I'm serious about this. One of my patients, a 67-year-old guy, came in for what he thought was a routine heart checkup. Nothing seemed off. He felt fine. But when I put the stethoscope to his neck, I heard a bruit on the right side. We ran the tests, and sure enough, he had about 60% blockage in his right carotid artery. We caught it before he ever had a single symptom, got him on medication, made some lifestyle changes, and we avoided a potentially life-altering event. Now, let me talk about something that I hear from patients constantly. And honestly, it's the number one frustration people share with me. They say, "Doc, I had symptoms. I went to the doctor and nobody took me seriously. They didn't listen. They didn't run the right tests. They told me to come back if it gets worse." I hear you. I really do. And it makes me angry because these are situations where early action saves lives. So here's what I want you to do. If you suspect something's going on with your carotid arteries, you need to walk into that appointment knowing exactly what to ask for. Don't wait for your doctor to suggest it. You advocate for yourself. Step 1. Ask for a carotid Doppler ultrasound. This is the gold standard first test. It's non-invasive, completely painless, takes about 20 to 30 minutes. It uses sound waves to create real-time images of blood flowing through your carotid arteries. It'll show if there's any narrowing and how severe it is. This should be your starting point. Step 2. If the ultrasound shows significant narrowing or if there's any uncertainty, your doctor may order a CT angiography, also called a CTA. This gives a more detailed map of your arteries. They'll inject a contrast dye into your bloodstream and take detailed CT images. It gives a much clearer picture of exactly how much blockage there is and where it's located. Step 3. In some cases, your doctor might recommend an MR angiography, or MRA. This is similar to the CTA, but uses MRI technology instead. It's a good option if you've got an allergy to iodine-based dyes or if they want to avoid radiation. And step 4, and for the most detailed look, there's traditional catheter angiography. This one's more invasive. A catheter goes in through your groin and up to the carotid arteries. It's usually reserved for cases where surgery is being planned or when other tests haven't given a clear answer. For most of you, the Doppler ultrasound is going to be the right first step. If you walk into your doctor's office and say, "I'd like a carotid Doppler ultrasound," they should take that seriously. If they don't, find a doctor who will. And after the ultrasound, the person you want to see next is a vascular surgeon. Not your regular GP, not a neurologist necessarily, but a vascular surgeon. That's the specialist who deals with these arteries day in and day out. Now, if a blockage is confirmed, what happens next depends on how severe it is. Let me break this down simply. If the narrowing is mild to moderate, under about 50%, the usual approach is lifestyle changes and medication. That means overhauling your diet, cutting way back on saturated and trans fats, loading up on fruits, vegetables, whole grains, getting regular exercise, even just a brisk 30-minute walk 5 days a week can make a real difference for your cardiovascular system. And if you're still smoking, you've got to quit. I know that's hard. I know you've heard it 1,000 times, but smoking is one of the single biggest accelerators of plaque buildup. Your doctor will also likely put you on medications, blood pressure meds if you need them, statins to bring down your cholesterol, blood thinners to reduce the risk of clots, and diabetes medications if that's a factor. If the blockage is more serious, we're talking 70% or more, then surgery becomes a real conversation. The most common procedure is called a carotid endarterectomy. The surgeon opens up the artery, physically removes the plaque, and repairs the artery wall. It's been done millions of times, and it's highly effective. The other option is angioplasty with stenting. This is less invasive. They thread a balloon into the artery, inflate it to widen the passage, and place a small mesh tube called a stent to keep it open. This is usually for patients who aren't good candidates for full surgery due to age or other health issues. Both options carry risks and benefits, and the right choice depends on your specific situation, your overall health, where exactly the blockage is, and how severe it is. This isn't a decision you make alone. This is a conversation between you and your vascular surgeon. Here's the bottom line, and I want every single one of you to hear this. The symptoms I just described, the weakness, the speech problems, the vision changes, the dizziness, they might seem minor. They might come and go in minutes, but they are not minor. Many major strokes are preceded by these exact warning signs. They're essentially mini strokes, your body's alarm system telling you that the big one might be coming. The statistics bear this out. About 1/3 of people who experience a TIA and don't get treatment will go on to have a serious stroke within the following years. 1/3. Those are not odds you want to gamble with. If you're over 55, if you've got high blood pressure, high cholesterol, diabetes, or a history of smoking, please make regular checkups a priority. And during those checkups, make sure your doctor puts that stethoscope on your neck. Ask for it specifically if they don't. It takes 10 seconds and it could change your life. And one more thing. If you've already been through something like this, if you've had a TIA or procedure, or you're dealing with carotid artery disease right now, I'd love to hear your story. Drop it in the comments, not just for me, but for the other people watching. Because sometimes hearing from someone who's been through it is more powerful than anything a doctor can say. You might just help someone else catch this in time. Take care of yourselves, gentlemen. Your health is the one thing you can't replace.